Ewing sarcoma is a rare and aggressive type of cancer that primarily affects the bones or the soft tissues around the bones. It most often occurs in children, teenagers, and young adults, and is more common in males than females. Ewing sarcoma typically arises in the long bones of the arms, legs, pelvis, or chest, but it can develop in any bone or soft tissue. Causes and risk factors. The exact cause of Ewing sarcoma is unknown, but it is believed to be related to genetic changes in the cells, specifically a rearrangement translocation between chromosomes 11 and 22. This genetic abnormality causes the formation of a fusion gene that leads to uncontrolled cell growth. Risk factors include age, most commonly affects people between the ages of 10 and 20. Gender, males are slightly more likely to develop Ewing sarcoma than females. Ethnicity, it is more common in people of European descent and rare in individuals of African or Asian descent. Symptoms of Ewing sarcoma depend on the location and size of the tumor but commonly include bone pain, persistent and worsening pain in the affected bone, often worse at night. Swelling or lump, a noticeable swelling or lump may develop at the tumor site. Fever, unexplained fever can sometimes be a symptom. Fatigue, feeling tired or weak without a clear reason. Weight loss, unintended weight loss over time. Limited range of motion, inability to move the affected limb or joint freely if the tumor is near a joint. Fractures, weakened bones may fracture more easily without significant trauma. Diagnosis. To diagnose Ewing sarcoma, a healthcare provider will perform several tests, including physical examination, to assess the affected area and check for swelling or tenderness. Imaging tests. These help visualize the tumor and check for spread. Metastasis. X-rays, initial imaging to detect any bone abnormalities. MRI. Magnetic resonance imaging provides detailed images of soft tissue and bone involvement. CT scan. Computed tomography to detect the spread of cancer, particularly to the lungs or other organs. Bone scans, to identify if the cancer has spread to other bones. PET scan, helps in identifying cancerous activity throughout the body. Biopsy, the sample of the tumor tissue is taken and examined under a microscope to confirm the diagnosis. Bone marrow aspiration, this test determines if the cancer has spread to the bone marrow. Staging. Once diagnosed, Ewing sarcoma is staged to determine the extent of the disease. Localized, the cancer is confined to the original site or has spread only to nearby tissue. Metastatic, the cancer has spread to other parts of the body, such as the lungs, bones, or bone marrow. Treatment for Ewing sarcoma usually involves a combination of therapies, depending on the location, size of the tumor, and whether it has spread. These treatments are coordinated by a multidisciplinary team of oncologists, surgeons, and other specialists. 1. Chemotherapy. Chemotherapy is the first line of treatment for Ewing sarcoma and is typically administered before and after surgery. It helps shrink the tumor, making it easier to remove surgically, and also targets any cancer cells that may have spread to other parts of the body. Common chemotherapy drugs used include vincristine, doxorubicin, cyclophosphamide, ifosfamide, and etoposide. 2. Surgery. Surgery aims to remove the tumor and surrounding healthy tissue. Depending on the location of the tumor, the surgical approach may involve limb-sparing surgery, preserving the affected limb, or amputation in more severe cases. After surgery, reconstructive procedures, such as bone grafts or prosthetics, may be needed to restore function to the affected area. 3. Radiation therapy. Radiation therapy is often used in combination with surgery, particularly if complete surgical removal of the tumor is not possible. It can also be used to target any remaining cancer cells post-surgery or in cases where surgery is not an option. 4. Targeted therapy and immunotherapy. In cases of recurrent or metastatic Ewing sarcoma, Targeted therapies that focus on specific molecules involved in cancer growth or immunotherapies that stimulate the immune system to fight the cancer may be considered, though these are generally in clinical trial phases. Prognosis. The prognosis for Ewing sarcoma depends on several factors, including tumor location. Tumors in certain locations, such as the pelvis or spine, may be harder to treat. Stage at diagnosis. Localized Ewing sarcoma has a better prognosis than metastatic cases. Age and overall health. Younger patients and those in good general health tend to respond better to treatment. Response to initial treatment. A good response to initial chemotherapy and surgery is associated with a better outcome. For localized Ewing sarcoma, the 5-year survival rate is approximately 70 to 80%. However, if the cancer has metastasized, the 5-year survival rate drops to 15 to 30%. Early detection and aggressive treatment are crucial for improving survival rates. Long-term effects and follow-up. Survivors of Ewing sarcoma may face long-term effects related to treatment, including growth problems. Radiation and chemotherapy may affect bone growth in children. Heart and lung issues. Some chemotherapy drugs can affect heart and lung function. Secondary cancers. There is an increased risk of developing another type of cancer later in life due to radiation therapy and chemotherapy. Regular follow-up care is essential to monitor for recurrence, manage side effects, and address any long-term health concerns. Conclusion. Ewing sarcoma is a rare but aggressive cancer primarily affecting children and young adults. It requires prompt diagnosis and treatment, typically involving chemotherapy, surgery, and sometimes radiation. Early detection and a multidisciplinary treatment approach offer the best chance of successful outcomes.